My name is Rosie, and I work at Kids Arthritis Care. And today I am talking a little bit about Humira, which is a very common medication that is prescribed by our pediatric rheumatologist, Dr. Robert Lowe. We usually get many questions in regards to this injection, and I hope whatever I talk about today is useful to our families. So today I am talking about the pen that looks like this. So here we have a number 1, here we have a number 2. I get many questions from our families in regards to this medication. Questions like, what do I do if it falls? What do I do if I feel like it's contaminated? What do I do if I feel like I misfired? So many of those questions are really good questions, and I would refer you to our Humira Ambassador Program, which is offered to all our patients who have been prescribed Humira. They will help you and guide you through any of those questions that you may have. Another question that I get a lot is, what can we do to make this, much easier on our families? Although this medication does tend to burn, what seems to help a lot would be icing it. That's some feedback that I've gotten from my patients. You can ice the site prior to the injection. You can ice the site after the injection as well. That tends to help. Maybe some distractions if you have a favorite book, if you have a tablet, if you like a specific movie. Those are always good things to put for the little ones who receive this medication, just for some distractions. If trying heat after getting the injection, if that makes it feel better, then by all means go ahead and put a warm towel on the side if that helps. Many patients tell me icing it prior to the injection helps a lot, kind of numbing the area of where the injection is going to be given. This injection is usually, it has to be given subcutaneous, so that means the fatty tissue. Our best recommendation is around the belly area and the outer thighs area. So with this one here, which is a very common one, you don't see a needle in the... So on this one, the way it's used, we have a little window here where you can see the medication. We want to make sure that we see it in there. We want to flip it up. So we can't see the medication in there. This is a sample demonstration tool, so I can demonstrate the functions of the pen. You would see the medication on there on the prescribed pen. So we have our number 1 and our number 2. Our number 2 is the plunger part. Our number 1 is where you would see, the number 1 is where the needle comes out. Okay, perfect. So I'm going to demonstrate with my orange. Sorry, I didn't know how to say that. A little demonstration. I'm going to pretend this is my patient's thigh area. So I would want to clean the site prior to the injection. Just like that. You want to do 2 circular motions around the area where you're going to inject. Okay, we have our gauze and we have a Band-Aid. I want to make sure that I see the movement of the medication in there. Again, this is a sample pen, so you do not see a medication. Okay, I'm going to release part 1 and part 2. I'm going to grab the patient's thigh, okay, and we want to make sure we get a nice fatty area where we're going to inject. And we're going to place the pen as so. And once we're ready, we're going to push the button and count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Release, and we are all done. Just like that. Again, we can ice the site after the injection, just in case we feel some sort of burning sensation when receiving the medication. I've heard from patients that that helps a lot. One indication that we've got all the medication in is when we see yellow on the window. That means the medication is completely gone.